Testosterone prescriptions are escalating at startling rates, creating nearly a $2 billion annual market. That is hard to believe. The drug is being used as an anti-aging sexual tonic for bodybuilding and doping. Dr. Irwin Goldstein from San Diego Sexual Medicine with why the surge in testosterone may be doing more harm than good. Tell us, first of all, Doctor, good morning.
Well, thank you always for doing this. Greatly
Of course,
appreciate it.
It's great to get the information out there. The new research from the New England Journal of Medicine, what does it say?
Okay, so the author is Finkelstein. He's an endocrinologist at Mass General Hospital. The title is Gonadal Steroids, Body Composition, Strength, and Sexual Function in Men. Fabulous study. It took a group of healthy men. It gave them a drug that stopped their testosterone, and they changed how heavy they were, changed their strength, changed their sexual function. So right away, it's a very important thing having testosterone. Then they gave them back either testosterone, which we all know converts to a product called estrogen, the women's estrogen, breasts and hips, or they gave them a drug that only made testosterone and couldn't allow it to convert to estrogen. And their conclusion was testosterone is very, very important for muscle strength, but estrogen, interestingly enough, is very important for sexual function and how much fat you have as a man.
Trying to break all of this down for the layman out there and trying to understand how this affects me. How do I benefit from this? You're talking about muscle mass, fat mass, strength, and sexual function. It's not really a surprise that different men have different levels of testosterone, right? So what does the study mean to me?
Yeah, but doctors, you'll say, I go to my doctor and say, gee, I have less strength, I'm tired, I don't have my interest in sex, and he'll say, oh, we just did your level and it's above a certain range. And now the new study says, well, gee, not everybody meets the criteria. So different people respond to different levels.
Explain again why the estrogen level is important for men's sexual function, because that's, you know, you think, oh, you have estrogen. What? Explain that.
Yeah, so there's a parallel in menopause. We just had a meeting, I think 2 weeks ago with Erica here talking about menopause, where you would think estrogen is the only thing in menopause, but it's testosterone and progesterone and other agents down on your genital tissues. So menopause, which I guess is the same thing of aging men, is more than testosterone. We for the first time in history, we're recognizing the importance of estrogen in men. So women is not just estrogen, and men is not just testosterone. We share gonadal steroids, and they're important in both genders.
Okay, so based on all this in the research, what happens when somebody gets prescribed testosterone? Does it have, what kind of effect does that have?
So, well, testosterone should be given for appropriate reasons. Tiredness, fatigue, low energy, muscle strength weakness, and sexual problems. You need to go to the doctor and get the blood tests. They now need to be expanded because estrogen now has to be a part of this based on these data. And when you start treatment, there are 3 kinds of treatments. There's a treatment you take daily, and that's a gel you put on. Or there's a treatment you do weekly, which is an injection. And there's a treatment you do every 6 months, which is a pellet insertion underneath your skin. So those are your treatment options, and you need to be monitored correctly.
Is the possible suggestion here is that in addition to just going to your regular doctor for checkups if you have these symptoms, is part of it should be to get your hormone levels checked at all times, because that could be indicated for so many different things.
Fabulous. So we're all aging, okay? After age 40, the testosterone falls 1.5% less than it was at age 1 year before that. So at age 50, it's 15% less, and age 30, it's 30% less. Past age 40. So the point here is, as you get older, there's 4 things we all need to do. We need to have diet and exercise plan. We need to have vascular issues taken care of, hypertension, high cholesterol, diabetes. We need to be in intimate, meaningful, satisfactory relationship health, and we need to have our hormones managed. Those are your 4 steps to your chair that will take you through aging.
I hear there are testosterone clinics where the lines are out the door. Is that true?
Well, I mean,
are most men aware of this and what this really means for their livelihood and for their lifestyles overall?
Let's say that maybe under 10% of men are actually getting testosterone treatment, where probably 40 or 50% of men should be on testosterone.
Unbelievable. You know, all these research, it's all about helping us and helping live better, longer, healthier lives, right? So this is very critical. Dr. Goldstein, thank you as always.
Well, thank you again.
Great information.
I have one last thing, if I can.
One last thing, please.
Yeah. We do clinical trials at San Diego Sexual Medicine at Alvarado Hospital, and we do trials on men with menopause and women with menopause. So if anyone's interested.
Contact this man right here, Dr. Goldstein, San Diego Sexual Medicine, San Diego, of course, at Alvarado Hospital. our website. It's all right there, fox5sandiego.com, doctor. Thank you so much.
You.
Great work this guy's doing. Erica, over to you.